Welcome to this short video that takes you through how to work in a Miami clinic that's using a combination of EMIS and TPP SystmONE. We're going to take you through how to use both of these systems, so I'd suggest you get yourself a nice cup of tea, settle back and relax as we go through the various topics. The first time you log into EMIS, you'll need to do this manually. You should make sure you complete your security details when you first log in. This means that if you forget your password or your smart card, you can reset your password yourself without having to ask for an administrator to help you. There's a couple of other basic bits of setup that's worth doing. The first is to customize your quick access toolbar. I'd recommend that you add the ability to add tasks and add access to the appointment book onto this. The other thing that you need to do is to set up your quick launch toolbar, which is launched by pressing the F12 key. When you start, this will be blank. There's two useful things that I'd recommend that you add. You can add these by right-clicking. Unfortunately, we can't set this up for you. It's an individual user-by-user setting. Right-click over a letter that you want to use. Click Add. And the first of these I would recommend is our Fever template. This allows you to record information quickly and easily in a structured form when you're doing a clinical assessment for minor illness. The other is it's worth doing some pathology labels. So pick another space. I tend to use letters that are relevant to the thing that I'm running. And take the pathology request form label. You may also want to pick up the pathology and specimen label, which has the advantage of printing both a form and sample container label at the same time. You can now insert your smart card for the first time and you'll see a yellow bar asking you to connect your smart card with your login. If you follow the instructions, this will then link your smart card to your EMIS account and you can then use your smart card to log in future, which is what we would recommend. One final setting that you should change is in your appointment book area, so click on the appointment book button at the top in your quick toolbar and go to the appointments configuration. You need to do a couple of things. The first is to change the registered patient to send in and start new consultation. The second is to make it easier on your eyes, because there's a lot of different colours used in Miami appointments, that you change to colour only status and time. Click OK and you're good to go. Once you've logged into Windows, you should next run EMIS Web. It's important you run EMIS Web before you start TPP, otherwise the smart card authentication can get confused. At some sites you'll see the configuration switcher pop up. This is just to make sure that the correct version of EMIS downloads for use with the Miami system. Make sure that the organisation ID says 28550. Next will pop up the EMIS Web login screen. It's at this point that you can insert your smart card. You want to pick the first of the innovations in primary care options that you have on your smart card, and then EMIS will automatically log you in. When EMIS Web opens, it will show you the home screen. This takes you to a list of your patients for your session on the left-hand side and a variety of other summary information elsewhere on the screen. You'll probably want to look at more detail on your list of patients, so you can do that by clicking on the appointment book icon in the toolbar at the top. Launch SystmONE by clicking on the icon. If you're already logged into EMIS because you're working at a site with dual logins, you can just click on Log On with Smart Card. Otherwise, this is the point at which you should insert your smart card. It's important that you do know your manual login for SystmONE, because if you forget your smart card or there's a technical problem with the smart card, you will be needing to log in manually. If you've forgotten your password, you can reset your password if you log in successfully using your smart card, so it's worth doing that before it becomes a crisis. Log into IPC Clinical Practitioner Access Role, and SystmONE will open up. Miami clinics are not just about working at scale, they're also about promoting the best possible benefits of general practice. One of those that we think is most important is about continuity of care, which we realise is difficult in a modern environment. Miami clinics can see simpler episodes of illness that are usually dealt with in a single consultation. By doing so, that frees up GP practices to provide more resources for those patients with complex needs or who need continuity of care. We also want to avoid pushing work back to general practices. We aren't doing a good job if we simply just send the patient back for another consultation with their own GP. We have also prioritised using local clinicians so that they're aware of local policies and protocols and can give the best possible and most efficient service for patients. The Miami criteria are closely defined. This is a deliberate policy to try and make sure that the sort of patients who are coming in for a Miami appointment won't need continuity of care, and many of their conditions will be dealt with in a single episode. We ask the receptionist to screen all patients that it's a new onset problem, that it's been there for less than about 4 weeks or so, that it isn't mental health or pregnancy related, and that they haven't seen a doctor about it before. If the patient doesn't meet these criteria, they shouldn't be filtered through to Miami. The reality is that some patients do get through, either because they aren't answering the questions correctly or because the receptionists aren't screening. It is important that you explain to patients where you can't really service their needs, and also that you feed back to the reception team at the practice so that they can improve their procedures and avoid sending patients who don't meet the criteria. As far as possible, you should try and deal with the patient's presenting problem, but acknowledge the limitations of the service that we offer. When a patient arrives at Miami, they will check in with the receptionist, who will obtain verbal consent to share their clinical records from their GP practice. They will also be given a written information sheet which contains more information about sharing their records, and patients are advised in this sheet that they should be talking about one problem only in the consultation, that it isn't for ongoing issues, and that we don't get involved in repeat prescriptions. Record sharing is fundamental to the way the Miami clinic operates. We rely on being able to see the patient's GP record to give them a seamless experience. Most patients actually think we already share their health records, and those who don't are usually happy to do so. Only a tiny proportion of patients actively opt out of record sharing when the benefits of it are explained to them, and our experiences in Miami are that only 0.03% of patients have actively opted out when they've come for a Miami consultation. Patients who don't want to share their records should be screened out before they come to Miami, but occasionally patients will come through who've previously opted out, usually after reading articles in newspapers or being worried about the care.data scheme a few years ago, and they will have closed off the option of sharing their records from their own GP practice. The TPP model of sharing medical records is quite complicated. The best way to think about it is that each organisation owns its own data, but also that there are gateways in and out that share information to the wider cloud of medical records for the patient. Each organisation has a responsibility to obtain consent from the patient relative to that organisation. So at the Miami clinic, the reception staff will gain consent for both in and out sharing of information from the Miami clinic. Other organisations, such as the GP practice, will also need to obtain consent to share information in and out. There are other organisations that also contribute to the health record, such as Child Health or the hospice. The design of the in and out gateway for information is specific because it is intended that for certain specialised clinics, for example sexual health, a patient may want to have their GP and other health records shared in so that they're visible to the sexual health team, but not have the nature of their condition or treatments shared back out from the sexual health service. The problem comes when patients haven't opted in or have actively opted out of sharing information from their GP record. From the point of view of the Miami clinic, in this situation, we would be able to see all of the patient's records that are shared back into the cloud, so the child health, the hospice information, but we wouldn't be able to see the GP practice data, nor would we be able to see sexual health. This is absolutely the way that the system is intended to work, and patients can choose to share information from and to each organisation. The problem is that we at Miami have no control over the sharing consent at the GP practice. And if the GP practice haven't obtained consent and recorded it at the time that they book the patient into the Miami clinic, then we have no ability to access that information. The patient will need to go back to the GP practice to change the settings, and we give them a specific letter that explains to them how to do this. The EMIS sharing model is much more straightforward. Rather than sharing into the cloud, it relies on information sharing agreements, creating pipelines of information between individual organisations. So we have an agreement between Miami and each of the EMIS GP practices locally, and the sharing of information just takes place between those organisations. There's much less possibility of information being accidentally sent to a third party, and as a result, GP practices using EMIS have been happy to sign up to share their patient records by default alongside this agreement. This means it's much less likely that you'll find a patient who isn't sharing their records. If a patient has opted out of sharing or hasn't actively opted in to share their record, then we cannot access their notes. This makes the consultation much more challenging, and we'll come to that in a moment. It is important that the patient is aware of this and that they're given a copy of the opt-out letter that we've created that tells them how to fix this problem with their own GP practice. So to reiterate, if the patient is not sharing out information from the GP practice, then at Miami we cannot see the GP record. It's worth noting we can often see other areas of health records, such as child health or hospice information, and that can give you the false impression that you have access to the full record. It's important that you look for the TPP Phoenix logo, which you can see alongside the patient information at the top of the record. If you can't see the TPP Phoenix logo, then you don't have access to the GP record, and you should treat the consultation with caution. In EMIS, you can see if you're sharing successfully because the sharing navigation tree will be visible on the left side of the screen. To view the shared record, you need to click on the section that says All Records and confirm that you've obtained consent from the patient. Receptionists will ask for consent on your behalf when the patient checks in at reception, so you can click on this with confidence. You can see the shared elements of the record because they are identified with the blue and red circular arrow logo, indicating the record is shared from somewhere else. If you can't see the navigation tree in EMIS Web, it means one of two things. Either the patient is a TPP patient and has no EMIS records at all, or the patient has opted out of sharing their records. We advise that you continue with your consultation despite lack of access to the records, but you do need to be very careful about the consultation. You may not be able to do as many things as you do normally, and it's important that you take an appropriate medical history, record allergies and current medications where appropriate. You should also ensure that the patient has been given a copy of the opt-out letter so that they can change their settings back at their GP practice. If patients don't want to share their record, they shouldn't attend the Miami clinics in the future. This screen shows you a bit more information about the patients that are booked in, including the reason that they've been booked an appointment. You can now see that you get information showing you the patients who are booked in. When patients have arrived, they'll get a little A icon next to their name and time on the screen. To call in a patient, you either press S or right-click. When the screen opens, you may see some consultations related to previous Miami consultations, but you won't be seeing the shared record. To view the whole shared record for the patient, you need to click on All Records. Your receptionist will already have verbally consented the patient when they checked in for sharing their records, so you can feel comfortable that you can click this box that the patient has given consent. Once you've done that, you can see that the shared records opens up, and you can see that shared items are marked with a red and blue rotating arrow. Anything that's local information recorded by Miami won't have this symbol. If you want to review the clinical record, you can go to the Consultations tab. This will take you to an overview and allow you to scroll through previous consultations. If you want to view the patient's current medication, click on the Medication tab. And if you want to look at their problem list, which is a key part of the EMIS method of working, you can click on the Problems list. When you're ready to go back into the consultation, you can just click on the Patient's Name tab and it will take you into this consultation screen. When you're ready, call the patient into the room and complete your consultation. It's important that by the end of the consultation you've recorded a coded problem in the record, because this is how we monitor the activity of Miami. EMIS will try and suggest the most commonly used appropriate codes depending on what you're typing in. When you see something that seems appropriate, you can select it and click, and you'll see that the problem becomes green. If you don't use EMIS regularly, don't worry too much about the other information about the problems recorded here, just accept the default settings. Once SystmONE has opened up, you can go to the appointment screen by clicking on the icon. If you're working at a Miami site that uses EMIS as the main diary and appointment booking system, we put TPP patients into a ghost list, and you'll see that the patients are marked in the appropriate ghost list for the location where you're working, and your receptionist will mark them as arrived, and you can open them and begin your consultation. If you're working at a Miami site where TPP SystmONE is running the appointment book, then you'll have an appointment list under your own name filled with your patients. Your receptionist will mark patients when they've arrived, and they will obtain verbal consent from the patient for sharing the Miami record in and out. When you're ready, you can view the consultation. Because this is a test patient, the TPP GP record sharing logo isn't showing up. So we've loaded a real patient record and anonymized the data, which you can see in this still image here. And you're looking for the TPP Phoenix to be present, which indicates that the record is being shared. If you can't see this, then you're not seeing the full record, although you may see some clinical information shared from other organisations. It's important for patients where you don't have full access to the record that you proceed cautiously and make sure you take a full history. Your responsibility as a clinician at Miami is slightly different to your normal role in general practice. As far as possible, try to complete an episode of care if you can. Make sure you safety net appropriately, directing the patient back to either their own GP practice or the NHS 111 system or the emergency department as appropriate. Try to avoid getting the patient to book a routine follow-up appointment with their GP unless it's necessary. We're trying to limit the impact on general practice and take work away from practices, not make extra work for them. Your entries into the clinical system are just notes. We don't ask that the practices read your notes, and they'll only come across them if they're reviewing the record for some reason. If you need the practice to do something or to be aware of something, then you'll need to send a task to the practice so that they can action it. Don't assume that they will find comments in the notes and be able to act on those. We're trying to limit the impact on general practice and not asking them to read every consultation that we generate. You can click on the other tab sections in order to add further information, and you can do this in any order that you wish. When you're recording information on the examination, you may find it useful to use the fever and infection template, which is a structured way of recording clinical information. You can add this to your F12 bar if it isn't already there. Press the F12 key and the toolbar will appear, and click on fever and infection template. This is just a simple structured way you can do many parts of a consultation and record coded information. You only need to fill out relevant sections of the template. It's not a requirement to complete every box. If you have specific information you want to record, you should do so. When you finish with your consultation in EMIS, you simply click Save. It will save the record and ask you to record some outcome information. You need to use your judgment as to whether this was an appropriate use of the Miami appointment. Because of the way EMIS works in showing shared records, it isn't always obvious for the GP practice that the patient has been seen at Miami. To make sure that there's an obvious marker, we send a discharge note. It isn't intended that this discharge note has any instructions or requirements for action by the practice, and we expect them just to file it without reading it. But it is there as a reference point should they need to refer to it in the future. You need to generate this record. If you aren't sure how to do this, you can follow the instructions on screen. Once it's generated, you just need to save it and close. Once you've generated the document, you need to send it back to the practice. This is a manual step which unfortunately can't be automated, and that's why we have to ask you to do it. You can either press the M key to view the medical record or the F6 key. Either of these will get you to the right place. Click on the Document tab. You'll see that a Miami episode summary has been created. What we ask you to do is just to click on Send Document and send it to the usual GP. That means a copy will drop into their own GP records and be visible automatically. Once that's done, go back to the appointment book and you can call your next patient. If you're seeing a patient who is registered at a practice that uses TPP SystmONE, then you still need to start by opening up the consultation in EMIS. This is because the whole diary is recorded in EMIS. So select the patient and the record will open. You can then go into TPP and complete the consultation in TPP, but when you finish, you should come back into EMIS and just record the coded problem. This is for statistical purposes, so we can count the activity that's been going on, but you don't need to do anything else beyond that. You can do your consultation in SystmONE as you would normally do. When you're recording your consultation in the notes, please make sure you have at least one coded problem, symptom or diagnosis. This is really important so that we can audit and track the Miami activity and make sure it's appropriate. Make sure that your notes are clear enough so that somebody else can continue the patient's care if necessary. Don't assume that they will understand all your abbreviations. The settings in Miami SystmONE are different to what you're used to. Some of the toolbars and clinical trees will have been redesigned to be optimized for what we need in the Miami system. Remember, you aren't using your normal version of SystmONE. Some of the local processes and protocols that you're used to using won't be active, and also that you'll be looking at shared records. The quality of the problem recording and note-taking of other practices may not be as good as your own practice, and that may mean that you need to be extra careful and not make assumptions when making treatments and plans for patients. You should also be aware that patient expectations can be quite variable, particularly as the Miami clinics get going. Patients don't necessarily know what to expect. They may have been misinformed by their receptionist when they had their appointment booked. And also, they may be used to a different level of service at their own practice to the one that you're used to offering at your practice. Please be accommodating and respect the differences that may occur. If you need to issue medications, click on the medication button. A medication dialog will pop up. Type in the medicine that you'd like to give. EMIS will suggest a number of predetermined dose regimes, and if one of these is correct, then you can just select it. Alternatively, you can type your own text if you prefer. When you're ready to issue the medicine, just click Issue. If you need to add more than one medicine, go to Add Another. You'll be then presented with the instruction to issue the prescription, and click, and that will be sent to the printer. If you need to issue a medication in SystmONE, click on the Acute button, which is on the top of the toolbar, and add the medicine that you'd like to issue. Click on Search and choose the preparation that you want to use. SystmONE doesn't often suggest the most helpful of patient instructions, and you may wish to type more specific instructions. When you've completed the medicine, click on OK. When you're ready to issue your prescriptions, click on the Quick Print button, which will send the prescriptions to the printer. Prescriptions in Miami are handled slightly differently. All prescriptions must be printed because at the moment EPS doesn't work for the community versions of the software that we use. You should make sure you know where your local late pharmacies are, and if you're not sure, please check with your administrator at the reception desk. You should make sure you prescribe following local and CCG guidelines. Don't add anything on as a repeat item. This causes lots of problems because repeat items can then only be cancelled or amended from within the Miami clinic and not from the home GP practice. If you do need to set something up that you think might turn into a repeat medicine, add it on as an acute and send a task back to the practice asking them to put it on as a repeat at their end. At Miami, we don't issue any repeat medications, and patients are told about this when they check in. The reasons for this are several. One is that we want to make sure that practice's own policies and systems for safe prescribing are followed, and at Miami we don't have each individual practice's own policies in place. Every practice has its own policy and systems for managing repeat medication requests, and it's important that patients engage with those and don't work around them in clinics such as Miami or the out-of-hours services. There are some exceptions where we should be issuing medicines that patients normally receive as repeat medicines. For example, giving out salbutamol inhalers for patients who are having exacerbations of asthma or COPD. The main aim is not to be issuing patients normal repeat medicines and to be directing them back into their practice's usual systems for requesting these. It's also important that Miami doesn't become seen as a backdoor for addictive drugs. Practices work hard to manage patients who have addiction problems. It isn't helpful if they can access medications that their own practice would prefer them not to be receiving. The nature of the Miami screening system, the fact that patients are supposed to be attending for problems that are new onset, that they haven't seen a doctor about before, and are not mental health related, should screen out most problems, but occasionally we do see people with problems sleeping or requesting strong analgesia. Our advice is that you shouldn't be prescribing sleeping tablets. If this is the first presentation with sleeping problems, the patient should be given advice and sleep management and hygiene strategies rather than tablets. We also advise that you shouldn't be in a position where you're needing to prescribe long-acting strong opiates, and wherever possible for pain, you should be avoiding giving out strong opiates of any sort or benzodiazepines, except on the odd occasion that you might want to give them out for muscle spasm in something such as back pain. You should also restrict the amount of codeine and controlled drugs that you issue. You should use your clinical judgment when prescribing and try to avoid prescribing any of these medicines unless necessary, and be aware that we do audit prescribing to make sure that clinicians are following the Miami policy. Patients with symptoms or findings who meet the 2-week rule referral criteria need to be referred. If you need to generate a referral form, for example a 2-week rule referral, it's important in EMIS to remember that you have to save the consultation before the information is available to be merged into a referral form. This differs slightly from TPP SystmONE, where the information is always live. You need to click on Document, Create Letter, and then search for the form that you need. So if we needed to generate a 2-week rule form, for example, we can type a relevant keyword. The form will load. You can type in relevant information. Make sure that you organise any relevant tests. When you've completed the form, save and close it. You'll get a pop-up message that tells you to send a task to the administrator. You still need to fill the administrator information in, so click on Teams, IPC Limited, and then click the administrator for the site and send it to your administrator. Make sure you give the patient information leaflet. If you need to generate a 2-week rule referral, you can access this through the dashboard up here, and this is also the place where you can find other forms such as non-obstetric ultrasound request forms and radiology forms. Click on the toolbar to open the dashboard and select the form that you'd like to use. You'll be asked to nominate the destination for the form. Very shortly, this section will automatically be filled in for you. Click on the Write Now button. Ignore any pop-up messages that come up. The form will open up for you and you can complete the relevant information that it asks for. Checkboxes can be made to work either by double-clicking on them and filling in the information that way, or you can use the Form Protection button to turn on and off the ability to fill in checkboxes. Fill in other relevant information, and your most recent consultations and other parts from the medical history will be attached at the back. Click Save and OK to clear that, It's important that you send a task to your administrator to tell them to send off the referral form. Pick the administration group for the site that you are working for. And I would suggest that you make sure that it's urgent by putting today's date on it and giving it a red flag. Click on OK, and that message will go through. You should make sure that you give the patient a copy of the patient information leaflet explaining the process. You then need to complete the referral form, adding any necessary details. If you identify that they need any additional tests, such as the blood tests that are required as part of the workup for an endoscopy, then you should give the patient the relevant forms and ask them to organise this. Once you've completed the referral form, send a task to the Miami administrator for your site, and they will send the form on to the 2-week rule coordinator. It's important to remember that it's the Miami administrator who is responsible for sending off referral forms and not your practice secretary. If a patient presents with problems that might need a referral but isn't part of a 2-week rule pathway, then the responsibility for actually generating that referral rests with their own GP practice. The reason for that is that different GP practices have a different range of skills, and they may also have referral management plans in place to reduce some referrals. We ask that you write clear enough notes that somebody could generate a referral if necessary based on your information. You should tell the patient that you will be contacting their GP practice and passing on the information, and that the practice will either make a referral for them or may contact them for further information or to start some treatment. You should then generate a task to the Miami team for the practice where the patient is registered, summarising the need for a referral, and the Miami team at the patient's own practice will then pass that to a clinician who will decide whether referral is needed or whether some other treatment strategy might be more appropriate. If you need to send a patient note or task back to the patient's practice, perhaps because they need a referral or further action, or perhaps because their Miami appointment wasn't appropriate and you need to feed back to the receptionist, then you need to generate a patient note. Click on the clipboard icon, which you can add to your quick toolbar. Click on Patient Note. Click on the magnifying icon and then Teams to select the recipient, and then choose the practice that the patient is registered with and look for a Miami-related group. Here there's a couple. You can pick with confidence anything that says Miami. Click on OK and click Send. If you need to feed back to a practice, perhaps because the patient needs further action, or perhaps because the patient didn't meet the Miami referral criteria, then you can send a patient task. Click on the Task button, choose the organisation that the patient is registered with, and then choose User Group, and look within the list of user groups for the word Miami. You should see one or more Miami-related groups, and this is what you should target because the team at the other end will be monitoring it and expecting Miami-related queries. Send your message and click OK. Organising an X-ray or ultrasound is straightforward. The results will go back to the GP's own practice, and you should make sure that the patient is aware to follow up the results with their own GP. If you need to do plain film imaging, such as a chest X-ray or joint X-ray, then both paper or electronic request forms are available. You should complete it and follow the local protocols for organising the particular imaging test that you require. Either give the form to the patient if it's something simple and they can walk in for an X-ray, or send a task to the administrator who will send off the form to the radiology department and the patient will wait for an appointment. If you need to organise an ultrasound, if possible use the non-obstetric ultrasound, any qualified provider form which can be accessed from the dashboard on your toolbar in SystmONE. Please make sure that you choose and specify which organisation you would like to provide the ultrasound, and then send a task to the administrator who will send off the form on your behalf. If you need to do something that isn't covered by the non-obstetric ultrasound form, then you should generate a radiology request for Western Sussex hospitals and ask the administrator to send it off. It's worth being aware that usually the waiting time for this service is slower than it is using one of the alternative providers. Remind the patient that the results will go to their own GP practice and that they should follow up the results with them. In EMIS, if you want to organise a test such as an X-ray, you need to go to the Document section and click Create Letter. The new patient letter box will pop up, and this will gradually fill up with commonly used forms that you've selected yourself. If you haven't got the one that you wanted visible, click on the magnifying icon and start typing in the search box with any relevant search term. This will generate the Western Sussex X-ray form. When you're ready to print the form, if you need to print the form, click File and Print. It's important that when you print forms or when you save them that you use the Mail Merge toolbar on the left-hand side. Organising a blood test through Miami is slightly old-fashioned. Unfortunately, the computer systems used by the laboratory aren't compatible with SystmONE when we're running it for Miami. That means that you need to generate a paper form, and to do this you should generate a printed patient sticker. To do this, you need to know which sort of label printer you have connected to your computer. It will either be a Dymo or a Zebra. Click on the relevant button, and this will generate a patient label automatically for you, and it will pop out within a few seconds. You need to complete a pathology request form, filling in the relevant details, and give the patient the form and advise them to book the blood test either with their own GP practice or to use whatever the local walk-in facilities are in your area. The results will go back to the GP practice for follow-up. If you think that the blood test is extremely urgent, then it is possible that you should be considering referring the patient for admission. When you finish the consultation, make sure you safety net the patient appropriately. You'll see a pop-up questionnaire that just asks you about the outcome of the consultation. This is for audit and statistical purposes. This slide summarises the principles behind Miami's responsibilities with regard to follow-up, referral and investigations. The underlying principles are that we should provide immediately necessary treatment for patients, but beyond that, we should loop results and follow-up back to general practice to establish continuity of care. We don't aim to see any patient to follow up any tests or investigations in the Miami clinic. If you have a patient who is inappropriately booked into Miami, it's important that you close the feedback loop so that the reception team are more accurate in the future when booking patients in for Miami appointments. Please send a task to either the GP practice's Miami team or to your administrator highlighting the problem, and they will feed back to the receptionist and ultimately improve the quality of referrals into the Miami system. It isn't possible, given all the many situations that can present in general practice, to cover every eventuality. However, hopefully this has covered most situations. Processes and systems change all the time, and this video may not be absolutely up to date. We do keep a folder of up-to-date information and procedures for clinicians and administrators in folders at each Miami site, and if you have any doubts, it's worth consulting those. If you need any help, ask your administrator. You could also contact one of the other Miami sites for advice by telephone or using TPP instant messaging. The Worthing sites have clinicians who've been working on the Miami project for 2 or 3 years now and are experienced in most of the issues that might be puzzling you. You can also contact Alice Townsend, Project Manager for IPC, at alice.townsend1@nhs.net, or you can contact me, Clinical Director, at n.ison@nhs.net.